just so that it's happening and I don't have to think about it. Okay?
Sounds good.
Because we can always edit it.
Right.
Hello, folks who are joining us. Welcome, welcome.
Hello.
Hi there. Just open the room. I'm gonna start greeting folks. Hello, folks, as you're joining us. We're delighted to see you all or to see images of you in the Zoom boxes. And we're going to get started in just a moment or so. And if you'd like to put your name or where you're based in Massachusetts, what organization you're with, so that we can kind of see who's here. Nice. Welcome, welcome.
Hmm.
Okay, so Tyler, I'm gonna get started because folks are starting to join us.
Sure.
And yeah, thank you for putting in the chat as we're getting ourselves settled in the room. You can share where you're coming from and what part of the state you're at and what organization you're with. You feel comfortable in sharing. And in probably about a minute or two, I'm gonna get ourselves together and we're gonna get started. Hello, folks. We've got Berkshires, we have Cambridge, Mass, Natick, Lenox, Pittsfield, Williamstown. Fantastic. Hello, Elizabeth, from the law firm of Elizabeth Reinhardt. Thank you. Concord, Mass. Lee, another from Cambridge. Wow, we've got folks from all over the state. I love it. From all over the Commonwealth. All right. If you all could just mute your either your technology, phones, or whatever you've got going for your Zoom, and we're going to get started right now. So I want to welcome everyone. My name is Samantha Anderson, and I'm the new executive director of the Nonprofit Center of the Berkshires. And our work here is focusing on strengthening the nonprofit ecosystem in Berkshire County. And as I've settled into my role, which is just 6 weeks to the day, I've been writing and speaking about the power of shared services and collective infrastructure, and how when we come together as a group, as a collective, we can build support that no one single organization can create on its own. And that's exactly why this collective benefits collaborative matters so much to NPC, to the nonprofits across the Berkshires, and to the Commonwealth. And it's just a fantastic way we can pool our strength to provide more sustainable benefits for the people who power our missions every day. We all know for too long, nonprofits have been asked to do more with less, each one trying to build its own HR, benefits, and wellness supports by scratch. But by coming through together, rather, through this collaborative, we're shifting from isolated efforts to shared strength. And the Nonprofit Center of the Berkshires is delighted to be able to present this workshop in partnership with Acrashore. And I'm going to make an introduction to our speaker in a moment. But my hope for this collaborative is that it becomes a tangible way we can honor and sustain our workforce, demonstrating that when we share services and solutions, we all gain stability, resilience, and the capacity to serve more boldly. So if I can ask if you could just please keep yourselves on mute while Tyler presents for the first half hour, and then we're going to open up discussion for questions and answers. So please pop your questions in the chat box if you don't want to speak yourself, and I will read those questions out loud. And last but not least, on the housekeeping, we're going to send you all a questionnaire after the presentation for your feedback. And we'll ask you if you have any other questions you'd like us to address in a future conversation. So now we are lucky to be joined by a seasoned leader in the benefits and insurance world, whom we were introduced to by one of NPC's board members, Kim Baker, who works for Acrashore. And she introduced us to Tyler Barton-Egan, who is a 35-year industry leader overseeing benefits and services for employers nationwide. And he brings deep expertise in plan design, modeling, and client-specific solutions. So please join me in warmly welcoming Tyler. And if your phone or computer is not yet on mute, I encourage you to do so that we can hear him loud and clear. Tyler, over to you.
Thank you very much, Samantha. It's a pleasure to be here. As Samantha articulated, there's strength in numbers. And what we're trying to do here today is something that has been tried in the past, but because of different legislative issues and problems, has never really been able to get off the ground until now. So what we'd like to do is to introduce to you the Commonwealth Benefits Collaborative. So for our agenda, and I'm pretty good at sticking on our agenda, so please bear with me. But we want to just mention a little bit about who we are, talk about the objectives of the collaborative, talk about our partner who we're going to be walking down the road with in order to be able to get this off the ground. We'll talk a little bit about key benefits, and then, very importantly, what we need from you in order to make this happen. We'll talk a little bit about the underwriting process, followed by important information, and then next steps and what our timeline is to be able to get this off the ground. So, who we are. Acrashore is probably not a common name that you've heard of, but we are a client-focused, technology-driven company, and we were started roughly about 13 years ago. We are now one of the fastest growing solution-based financial tech companies in the country, with over 17,000 global employees located in 22 countries. We also have 24 locations throughout New England. Our focus is property and casualty, personal lines, and employee benefits. My partner Tony, who unfortunately could not be with us today, and I combined have over 60 years of insurance experience. So we've kind of been there, we've done that, but we finally have been able to kind of break away from the same type of things that we've been doing in the past to try to do something a little bit unique. So, what are our objectives of this collaborative effort? Well, we start off by saying we heard you. We've been out and talked with many nonprofit and not-for-profit organizations, and we had the same type of common themes: greater affordability and accessibility. You wanted a plan that would have the ability to attract and retain some of the best talent in the industry. You wanted more predictability with annual renewals. You wanted more choices with plan offerings, easier administration, and professionally managed group benefits. And when we say group benefits, instead of being in a smaller pool, we want to be able to offer you large pool benefits. So, what are some of the key benefits that we're striving to do? Well, we want to have affordable premiums through a group purchasing effort. So, let me explain this. Right now, if we tried to underwrite or try to purchase insurance for each one of your groups, a lot of it's going to be dependent upon your group dynamics, your age, sex, demographics, where you're located, how many employees you have. Here, with this type of a group purchasing effort, what we're literally doing is combining all of the organizations that are either nonprofit or not for profit and being able to look at them as one group. Other key benefits here: an extensive and flexible coverage option, rate stability. We want to have simplified enrollment, billing, and service platforms, communications and compliance, which, as a lot of you know, is becoming more and more prevalent these days, a focused service team that's dedicated to each one of your organizations, and obviously a concentration of medical first and then followed up by other potential benefits. So, future considerations after medical, we would want to take a look at some health and wellness programs and also some voluntary benefits. Those voluntary benefits could include, but not be limited to, critical illness, accident policies, hospital indemnity, short and long-term disability, vision coverage, life and AD&D, and yes, even pet insurance. So, how are we going to get this off the ground? The problem has always been trying to find a willing partner. Now, as you probably know, you're probably familiar in Massachusetts with Blue Cross and Blue Shield, United, Health New England, among others. Right now, when we've tried to market this type of a concept and idea to those carriers, there was very little receptivity. However, after a lot of diligence on our part, we were able to come up with a partner whose name is Creative Benefit Consultants and their underlying plan called Triad Benefits. Now, Creative Benefit Consultants, or CBC for short, is a distribution channel for innovative self-funded programs with a major focus on small to mid-size employer groups. So their focus is implementing comprehensive health plans designed for small groups. The key feature of this particular program is that they happen to have a suite of ACA compliant plans built on a proprietary structure that allows small groups the buying power of a large group. So let's talk a little bit more in depth about what this means. So the structure is actually something called an insurance captive. So a captive is nothing more than a group of companies that have come together. They've created and wholly owned a licensed insurance entity. This entity has already been built. So what we're doing is we're creating an organization based on all of your census information and demographics and entering into this captive arrangement as one group. So why a captive format? Well, what it allows us to do is to have tailored coverage. There's going to be 5 different copay options to choose from and 3 high deductible health plans or HSA compatible plans to choose from. What's nice about this is that while the group is going to be presented together for underwriting purposes, each group can individually choose which plans that they want to offer to their employees. So we're getting together for the pricing of the insurance, but everybody would still get to choose which of the 8 plans they would like to offer. There's also a lot of cost efficiency. There's an elimination of a lot of overhead expense and profit margins normally found in regular employer-based coverages. There's also profit retention. So if the collaborative performs well, what ends up happening is that those profits are reinvested to keep insurance premiums in the future lower. And obviously, there are some tax benefits to this. I won't get into that because that's starting to get a little too granular. But for our purposes, understand that the captive model will absolutely work. So our overall goal is to secure a commitment to join the CVC from a significant number of nonprofit and not-for-profit organizations for the purpose of obtaining cost-effective and comprehensive health coverage. So that's our main focus and goal here. So what do we need from you to try to make this happen? Well, there's only 3 or 4 different pieces of information that we would need in order to have you, quote unquote, entered into this big group arrangement. First, we would need to have a census. So what does that census need? That census would need the first and last name of any employee, their date of birth and their gender, and the first and last names and birth and gender for all dependents to be covered. We'll also need the employee's home zip code. We'll need to have a current carrier and plan design with the information of the census, a current bill that lists the covered employees and associated premiums, and we're looking for this information no later than September 1st. So you're probably asking, well, have you ever tried this before? Last year in the fall, we tried this initiative. We found that there was not enough time to get all the information in, underwritten, and then be able to get people enrolled. So what we did is we put a pause on everything and said, okay, let's start this again in the January, February timeframe and see if we can then get a little bit more interest and not have everybody rushing to try to get all this information to us. So long story short, over the next couple of months, we're looking to gather these simple pieces of information in order to be able to establish what our baseline premiums would be. So let's talk a little bit about that underwriting process. If you're interested in taking the next step, and again, this does not mean commit to the program, it means just taking the next step to see what type of rates we might be able to develop. That information in the aggregate is going to be then provided to our underwriters. Once the information is gathered, all the census information will be forwarded not only to the medical underwriters, but all annual premiums will be generated Annual premiums generated will be offered to all participating organizations, regardless of their size and number of employees. So they're going to take into account your age, sex, any other demographic information, and then create one overriding rate for each one of the plans being offered. Now, all groups who join the collaborative will join individually and be able to select their own plans from the 8 that are being offered. So just to reiterate, while you're part of the collaborative, you still happen to have individual choice based on what your particular needs are for your own individual organization. One important point. We are currently out here talking to various nonprofit and not-for-profit organizations. We are hopeful that we'll get enough initial interest where we can establish the baseline of rates. But it's incredibly important to understand if the final participation falls below a reasonable expectation of the underwriters that we're going to, the collaborative coverage will not be offered. So let me explain. If we go out and say we have maybe 200 or 250 individuals through a myriad of different organizations come together for the purpose of doing the insurance. After we have a subsequent follow-up meeting to say, here are the plans, here are the associated rates. If we don't get enough organizations to commit to it, and let's say for argument's sake, that 250 went down to 50 employees, either rates would change or the CBC would most likely rescind their offer of coverage. That's why we're trying to get everything over to the underwriters by September 1st. We'll have a final answer sometime mid-September, where we'd then like to be able to come back to you and say, okay, we were able to get the insurance. Now we want to find out how many people would actually like to join. So, as I mentioned before, we are in the exploration phase and looking to see how many interested people might be to take the next step. And like I said, final commitment to join the collaborative would be 90 days before the effective date of the coverage. Our initial start period is going to be January 1st of 2027. Depending on how many organizations decide to join, will then allow us to then take a look at potential future dates to join the collaborative of either April, July, or October of 2027. Finally, one last thing to keep in mind with any type of collaborative, we're going to be looking for stability in administration. There'll be certain types of association rules and bylaws that we'll most likely pull together, but please understand this is not going to be a multi-year commitment. We just want to be able to say, look, during that time, we'll provide the following. We'll provide things such as experience, so we can tell you a little bit about how you're doing personally, what future dates might be, what types of different plan designs we might want to see in the future, and so forth. So our next steps and timeline is obviously obtain complete census data and other information from interested organizations by September 1st, submit all the information to the CBC and Triad for their review and underwriting. We'll reconvene mid-September to present our findings. Hopefully around that time, we'll be able to receive enough commitments from interested parties to join the CBC. We'll then outline all benefits, communications, enrollment procedures, plan benefits, etc. So we'll be conducting individual enrollment meetings for those who want to join. The effective date of the coverage will then commence January 1st, and there'll be a 1-year contract with the contract ending on December 31st. Also, we're going to outline ongoing collaborative initiatives such as additional benefits, administration, guidelines, etc. So, once we're done with the CBC or the discussion here, information, and we'll end up sharing this with you again, would need to be sent to both myself and my partner, Tony Chandler. Information can be sent by email or any other method you feel you could get it to us. But once we have that information, we'll then be pulling it all together and then hopefully moving this effort forward. So what I'm going to do right now, Samantha, is I'm going to take a little breath and hopefully we can take some general questions and answers and see where that leads us.
Excellent. Thank you so much, Tyler, for that terrific presentation. And we have a couple of questions coming through, one in the
Sure.
chat, and I'm going to open up also Kathy. You can take yourself off of mute, Kathy, and ask your question out loud. I see your hand raised.
Sorry. Hi. Well, this is fascinating, and I'm very interested in sharing this with our coalition, which is about 100 nonprofits. But before, and now I have a clue about why this might be. Before this meeting, I tried to look up Acrisure in AM Best, and I didn't find that you were rated. So that's the part one of the question. Are
Okay.
you working as a DBA, or why couldn't I find you in AM? And AM Best for other people is the industry standard for rating the reliability, the safety, et cetera, of different insurance companies.
You know, Kathy, that's a first for me. I don't have any idea why. In fact, I came from an Aetna and Connecticut background, so I know how important the AM Best ratings are. Um, I would venture a guess it's probably because we're only about 12 or 13 years old and maybe there's not enough traction. We right now are not publicly traded, so that might have something to do with it. But we do happen to have presence in all 50 states and 22 foreign countries. And if it's a question of getting any kind of testimonials or recommendations or anything along those lines, I'd be more than happy to share those with you.
Okay, so it is a little worrying. That's number one. But if I'm understanding it correctly, you all are not actually doing the underwriting.
No.
So we could look up the underwriters once you line up who those are.
Right.
Okay.
So, yeah.
So the basic thing here for people who aren't as familiar with insurance is you don't want to get insurance for a company that is financially insecure because then you might lose the insurance you think you have. Thank you.
Okay.
Thank you, Kathy. Thank you for raising that. It's absolutely critical that we know all of the challenges and risks alongside all of the benefits for sure. So thanks for raising that. There are and actually Tina Powderly from the Franklin Food Pantry. Sorry, no. Sorry, Michaela Lewis said we currently use Acrisure for insurance, both business and benefits, and have been very happy with them and have been with them for the past 3 years. So um, we also have a few questions in the comment. One came from Oak Brasset, sorry. And the question is, would this coverage cover gender affirming care for both the employee and any dependents they have? Want to make sure it's included given the current politics.
The short answer would be yes. So at this particular time, additional, what's covered, what's not would then be presented during our September meeting. So this would be something where if there was any changes to that, we would be able to communicate that at that point. But we want to make sure that people understand because, if it doesn't follow every last benefit that a mandated benefit from the state of Massachusetts, we want to be very clear about what it will and what it won't cover. So that'll be something that we'll definitely disclose during our September meeting.
Okay, great. And I'm gonna let the Stockbridge Library has just raised their hand, so I'm gonna allow them to come off of mute and ask the question.
Perfect. Thank you so much. So my question is about filling in the census and providing all of my staff's identifying information before we even know what we're getting. In other words, I understand you need the census in order to tell us the rates, but I'd like to know more about the specific coverage in the Berkshires. When I look at insurance companies like Health New England, for example, I can look at what doctors are covered. So before I provide information about my staff, I need to know if the doctors that they
Mhm.
use are covered and who's going to use this information. What are you going to do with the information, and how do you ensure for us who may participate in the census that you're protecting that information?
Um, I guess the way to answer that is if you currently happen to have Health New England, at some point you would have submitted some sort of a census in order to be able to be underwritten and or priced for your particular policy. This is exactly the same thing. Your network would be Cigna. So the underwriters are basically brokering. There's a term called custom health plans. And what a custom health plan basically does is instead of having everything housed under one. So if you went to, let's say, Blue Cross, you're going to be getting their network, you're going to be getting their underwriting team, you're going to be getting their third-party administration, you'll be getting their the pharmacy benefit managers. With the custom health plan, which is basically what we're dealing with here, you would have your own a network that would be obtained for the purpose of, providers. You'd have a separate pharmacy benefit manager. You would have a third-party administrator that would be doing the actual administration, paying claims, etc. And the underwriting team is the one that's pulling together all of this information. So the same type of care that would go into you providing this for Health New England would be going into what we'd be doing here. So there wouldn't be any kind of, mishandling, so to speak, of any of the information. That's why if you are going to be sending this to us via email, we would be doing it with a secure socket line, and that information doesn't go anywhere farther than the underwriting team that's taking a look at the risk.
Thank you, Tyler. I'm going to
Yeah.
take a question from the chat. Somebody asked, how is this different from a PEO?
It's kind of night and day. With a PEO or a professional employer organization, there are various pieces that they're offering you under one umbrella. So, for instance, you would have your payroll, you may have your employee benefits, you might have your workers' compensation, you may have an investment piece, HR, health, etc. With this particular endeavor, we're just looking at the actual insurance portion. So you would not be changing your current payroll if you happen to have an outside vendor doing that. We wouldn't be changing HR or anything like that. It would be just like if you went to Health New England or United or Blue Cross. That's what we're offering here, the same type of coverage that they would be offering on a direct basis.
Okay, thank you for that. And now, Mike Miller, if you could take yourself off of mute and for your question,
Yep,
please.
thank you. I want to circle back to the second half of Wendy from Stockbridge's question. I think you may have sort of answered it, but I wanted to dig a little deeper.
Sure.
So, did you say that the network of hospitals, doctors, pharmacies would be based upon you? That would be from Cigna? And
Correct.
if so, do they have a single network for each of those, or do they have multiple tiers and what I like to call flavors of different structures of networks, some skinny, some broad?
Right. That's an excellent question, Mike. What we're going to be basically doing is offering their broadest network of doctors and hospitals. So care is not going to be just limited to Massachusetts. If someone needed to have care in New York or Connecticut or wherever else people might live, there would be a contiguous network of doctors and hospitals. So that Cigna network would be the broadest that they currently offer.
And do you know what their network is like in the Berkshires currently?
Currently, I would be a little remiss in saying I know exactly what it is. I
Okay.
do think that they happen to have a very large complement of doctors and hospitals. I'm also familiar with the fact that out in the Berkshires that there doesn't seem to be a tremendous uh, amount of providers that the carriers have. I know there's only a couple of carriers like United and possibly Health New England, which seem to have a full complement. But that would be one of the things that we would sit down and do something called the network interruption analysis. So if this was a concern to the organization that wanted to join, we would simply then try to have some sort of a network match, so to speak, to see are your providers in the network? If they're not, this might not be a good situation for you. However, if it does cover the doctors and hospitals you need, then that might be one less hurdle you have to worry about.
Okay, Mike, do you have anything else to ask or, okay, thank you. All right, we're going to go back into the chat and Tina from the Franklin Food Pantry is wondering when would cost information be available? My organization would need to understand the potential cost burden, employer share, sorry, before committing. Is that what we'd learn in mid-September when you present findings? And then there's a second follow-up question to that. And will this price be locked in for a January start date? Last year, there were so many moving pieces due to federal changes right up until the end of the year.
Mhm. So I try to remember the sequence of the questions, but I can take the last one and say yes. Rates would be starting on January 1st and then lasting for the full 12 months. So any rates that are developed now would be implemented in January. So in September, yes, that's the time that we would kind of bring this out and say, here are the rates. Now, remember, each organization may have their own contribution strategy. So it's very possible
Right.
one organization may pay 75%, another may pay 50%. That's fine. This is your own organization. So you can pick your contributions. You can pick what plans that you want. It's not going to be, everybody has to kind of pick the same one.
Okay, so Tyler, I'll just read again Tina's question. I'm not entirely sure it was answered. Her organization would need to understand potential cost burden
Mhm.
before committing or after committing. Would that information be shared?
Well, before committing, we're not going to have some people, are you going to join and then turn around and say, ha, here's the price.
Right.
Rather, we want them to understand what the price is because it's very possible, Samantha, that if they happen to have a very young single population, that maybe the rates that they have and the plans that they have might be as good or better than what's being offered here. We don't know until we're able to pull all this together. That's why there's a lot of unknowns. So for us, it's taking that next step by saying who may be interested in this. We're not asking for that commitment yet, but who might be interested because we need to have that critical mass underwritten. The
Okay.
organization's not going to unfortunately throw out a rate and say, hey, what do you think about this? They want to do a little bit of field underwriting before they come up with any kind of
Okay.
premiums.
Okay, great. Kathy had a comment based on the first comment that she made earlier in the Q&A. Nope, separate and apart from that comment. It is, to, may I read it, Kathy? Or would you wish to, you're on mute. She's trying to unmute.
I
There you
think
go.
I wrote it and then erased it and asked it verbally.
Oh, okay, got it.
Okay.
Okay, sorry. I'm getting to the
I thought
comments
I'd
as we're
erased
going.
it. I'm sorry.
No, it's fine. Absolutely. Okay. Gabriella has a question. We currently offer an HMO and a PPO option to our employees. You mentioned several different plans to select from. Will each nonprofit be limited to selecting one plan, or could we select multiple plans? Okay, he's
You could
holding up his
have
thing. Yeah.
up to three, up to three.
Okay.
Otherwise, the administration gets a little bit wonky. And when I say administration, if you happen to have 5 or 6 plans, it gets a little bit, tough to try to manage that many. So what we basically would be doing is saying any three you want, just pick whatever might work best for you. And all the plans are point of service plans, or actually they could be PPO considering the national network. So in other words, you have an in-network benefit level and an out-of-network benefit level. So it's like having 2 plans fused together.
Okay, great. Oak has another question, and I really appreciate these kinds of questions. So, do pre-existing conditions impact folks' ability to get coverage? Want to make sure our disabled folks would be covered.
And that is why we're doing all the underwriting. If we had one group and let's say there were only 5 people and someone had claims that were unfortunately, in the hundreds of thousands, most likely that group on its own would be declined. However, if you happen to have a couple hundred, 2, 3, 4, 500 people that are actually involved, then the impact of those claims on that individual are mitigated. So the option or the outcome would most likely be there would be an offer. Now, will rates be impacted one way or another? That's to remain to be seen.
Okay, I'm heading back down into the chat. And again, if you do have a question and you wish to speak it verbally, you can raise your hand and I'll call on that. Charity has a question, or actually following up on Kathy's point earlier about not seeing a rating online. I just read that Acrisure just recently merged with a major broker, Madanas, in Israel. How much money, if any, from our insurance premiums or other funds from insurance brokerages with nonprofits would go to supporting APAC or Israel via Acrisure?
Right now, any kind of revenue that is generated here in the North American space is not reallocated to other efforts or endeavors overseas. So your premium dollars are not going to be funding an organization or an acquisition. That's going to be simply here. Every silo, so to speak, with at Acrisure. Remember, we have employee benefits, we happen to have property and casualty, we have personal lines, and then there are other different types of organizations and different types of things like our real estate division, et cetera. That has whatever your premiums are here stays with this one silo, which would be the employee benefits. It does not go to any type of acquisitions.
Okay, thank you. Any other questions in the chat? I don't see any other questions in the chat. Does anybody else have any questions? Kathy, I see your hand up, so you can unmute, please. Oh,
There we go.
Kathy.
Sorry. Um, there was the person from Stockbridge was asking, I think, about privacy issues. So my assumption is because you're an insurance agency or like an insurance agency that any information we provided to you would be protected under HIPAA.
That is correct.
Okay.
And in fact, remember, folks, Acrisure is a broker. So we go out to the various markets, but as your broker, we make sure that any and all information is protected. We have to follow all the different HIPAA laws, rules, and regulations. So any information that comes to us, we need to make sure that it's in a secure socket line, or if you're not comfortable with any kind of electronics, we could very easily have this either sent to us or, we can even pick it up from your organization if that's, what your comfort level is.
Okay, Wendy from Stockbridge Library has another follow-up.
Thank you. Sorry to ask two questions. So I'm very interested in this. We are a small nonprofit. We have 3 covered employees, and our current health insurance is pretty costly. I just continue even after your presentation, and the same with last year. I contemplated it last year. I just continue to feel a little uncomfortable about a number of things. Kathy's point about this company not having a rating online. And you, Tyler, you said it's just like Health New England or just like Blue Cross, except those are really big known names. And Acrisure doesn't have the same clout. So I guess my question is, does this webinar is put on by Nonprofit Center for the Berkshires? Does Nonprofit Center for the Berkshires know a lot about this organization? And are you endorsing this company by presenting this webinar?
Wendy, thank you for your question. And I don't know if you heard my introductory remarks, but one of our board members who serves as our secretary is a senior client advisor at Acrisure, which if you're in Stockbridge, it used to be Tool Insurance. So Tool was acquired by Acrisure. And Kim Baker, whom I think is a pretty well-known name in the Berkshires, she serves on many boards here, is the one who made this connection to Tyler and his partner, Tony. So if you have any questions, unfortunately, Kim couldn't be here today. She's traveling, but were she here, she probably would have come on and shared a little bit more about Acrisure and its presence here and so forth. But again, it's a great question. And, we're taking all this is why we're having this webinar is to hear really what's important to you, what your concerns are, so that we're holding all of those concerns as this plan is rolled out. So there isn't a endorsement from the nonprofit center. It is what we do, sharing information, educating, etc. And we leave it to you to make the hard decisions about what you decide to do. Right. Okay. Gabriella has a hand up. So please take yourself off mute.
Yes, thank you. I wanted to ask a question about timing, and I'm definitely new to the kind of benefits administration role, so this might be a rookie question, but we work with One Digital right now as our broker for benefits, and we have a mid-September date for renewal, and so we're already getting the questionnaire, kind of starting the process with them, and obviously would need to do something before that mid-September ending of our current plans. So for people that aren't on this kind of January cycle, how would that work if we did kind of put ourselves out there, share that information to want to, be a part of it, but or had to already commit to something else for, starting in September?
That's a great question. So it's going to take a little bit of explaining. So if you bear with me. So everybody here on this call most likely has an effective date of their coverage. Some people may be January 1st when they renew. Others may be April or March or September. It could be all over the board. What is going to end up happening is that if you happen to renew right now, if you were to join in January, you would have a short plan year. So that might impact your decision making, and here's why. If, for instance, you renew September 1st and you happen to have a big claim and someone reaches their out-of-pocket maximum, by joining this collaborative, it would reset. So in a period of 12 months, that or whenever 14 months or whatever, they would have paid potentially two out-of-pocket maximums. If you remember in the presentation, we had talked a little bit about getting a commitment in terms of January, but then looking at other effective dates of possibly of April 1st, of July 1st, October 1st, because we realize they're going to have these type of situations to renew and then move for 1 month. It's not as bad as moving for 6 months. So we're well aware of that potential conundrum, and we certainly don't want to put anybody in peril or have them pay more than what they would have to pay. But if there is any kind of an interest in this, maybe you're not part of the first round, but our big conundrum, unfortunately for us, is that we still need that critical mass to start the program. If we don't get it, then no harm, no foul. You will still be able to renew with your current broker, your current carrier or carriers that you may be entertaining. So again, this is not an exact science, but I think it's a very important question. And I think that for those of you who may have an off-cycle enrollment date, that would be something that would require some additional conversation with us to be able to kind of guide you through, is this the right time? If so, maybe this might be the time for you, etc.
Okay, Tyler, we have a few hands up, but there's a couple of questions in the chat that I just want to address. So
Sure.
if the collaborative launches,
hmm
will we have an opportunity to join once it's established, once rates become available?
So the hope would be that we would have enough people to start. So if you are looking at possibly later in the year, the question that we have right now is we are not sure if the same rates in January would apply, because let's assume that you started April 1st. You'd want a 12-month contract, not a 9-month contract. So would your effective date be April 1st? And that might require different underwriting because it's a different group that would be joining. So at this point, if there's interest in joining, but not at this time, we would have to kind of think through how that would be accomplished. Because again, people may have a short plan year, or we may have to be able to work with our underwriters to say, look, we may have 4 start dates throughout the course of the year. This might be the April start date. This might be the July start date. This will be the October, and then finally the January start date. And each one of them may have different rating structures for that, only for the simple reason that, rates you want to have guaranteed for at least a year. So that's right now, we have not come to that conclusion yet as to how that piece would work.
Okay, we have two hands up. Michaela, if you could unmute yourself and join.
Hi, thank you so much. My question is kind of around commitment, and I'm phrasing this because this past year we were hit with quite a high increase to our plan. And if we move forward with being a part of this group census-wise and then potentially committing past that, is there a multi-year commitment to stay a part of the collective? Kind of around like potential rate increase the following year out, or if people left and then that negatively affecting the collective. So would there be a time commitment to staying a part of the group?
That's another great question. We initially toyed with the idea of having a multi-year commitment only because we were concerned about stability. But if we have enough people in that core group, and again, as long as claims are running fairly well, then if right now we've landed on the fact that it's a 1-year commitment. So
Mhm.
if the following year something changes or the rates in the collaborative, are higher than something you can get on the open market, then we don't want to necessarily, lock you into a 2 or 3 year commitment. So
So
one
follow-up
year.
question on that, and I might have missed this, so sorry if you've already addressed this. What is that commitment minimum that you would need in order to have this launch?
In this this type of an approach, size matters. So if we had 100 people, I don't think rates are going to be as aggressive as if you happen to have 200 or 300 or 500. If you look at the large group markets, typically they have a better per unit cost for their coverage. In the small group market, there's not enough people to necessarily spread the risk. That's why your per unit costs are typically higher. So our hope is to get as many people interested as possible because through a larger number of employees, we are most likely going to get preferential rates. That's kind of our catch 22 here at this whole effort that we're trying to do.
Okay, thank you for explaining that.
Sure.
Okay, and now Kathy has a follow-up question.
Okay.
So this goes to having lots of people have, just in terms of numbers and numbers across the state, have you approached Jim Clockey at the Massachusetts Council of Nonprofits? I would think that the way to reach a lot of organizations would be through them.
Yes. Yeah, well, I've been in touch with all three of the other nonprofit centers. So Jim, of course, and Leah from Metro West is on
Is
today's
here.
call.
Yeah.
And also somebody else from the Cambridge Nonprofit Center. I can't remember exactly
It's
who she
us.
is.
It's
Oh,
us.
It's you. Okay, so yes, the answer is everybody has been contacted, and distribution around the state has been and
And has
also,
Jim expressed, well, we can talk about that later.
well, also, I mean, Tyler is presenting in a few weeks on this
Okay.
topic on the Mass Council of Nonprofits platform. So Tyler can
Good.
share more
Okay.
about that.
Okay,
Right.
good.
And remember, folks, I want to be clear. We are trying to do something that, to our knowledge, hasn't been created before. We cannot guarantee what the rates will be until we have information to provide. And as you can imagine, we really believe in what we're doing. It's just we need your help to be able to get it off the ground. And in the worst case scenario, as we've said before, if we don't get this off the ground, you still happen to have your current coverage. You have your current carriers. So nothing changes there. But we're thinking that by combining everybody together, we're going to be able to offer something that's going to be a little bit more cost effective.
Okay, thank you, Tyler. Callie, if you can take yourself off mute.
Hi, thank you. I'm from Berkshire Ag Ventures in Great Barrington in the Berkshires, but so we're a nonprofit in Massachusetts, but we have employees that live in both in Massachusetts, Connecticut, and New York. And so just want to confirm, I remember we talked about this the last time this was explored, but just want to confirm that employees who live in states other than Massachusetts would still be eligible for this coverage.
Yes, they would. In fact, I'm not sure if you remember, but I had mentioned that Cigna is using its national network of doctors and hospitals. And so if you have employees in New York, Massachusetts, Connecticut, Rhode Island, wherever they may be, they're going to have access to
Yep.
different providers, hospitals, et cetera.
Okay.
The only thing we don't know, to Mike's earlier point, we don't know what kind of disruption that might be based on who you may be currently using for your current coverage.
I just want to add
Thank
something
you.
too about scale. I understand people are concerned about the carrier, and the nonprofit sector in the Berkshires represents about 25% of the economy's GDP, and about 25% of residents in Berkshire County work for a nonprofit. So we have a substantial amount of leverage, power, et cetera, to invite a carrier that might not be here to join because of all of the employees in the workforce who would be participating in such a carrier. So I know, for example, I sometimes go to Springfield for some of my health care, and I know Cigna is carried throughout the Bay State system. I also go to Boston for some of my doctors because, the Berkshires are quite rural, but we have power for our own, with our community. And so, Tyler, you might want to just touch on that too.
Yeah, one of the considerations we had was, how and what kind of a network would be available. One of the biggest challenges we've been having since we've started doing some work in the Berkshires is really trying to navigate networks and availability. That's why when we started looking at networks, Health New England's got a great local network. Make no mistake. We use them for a lot of our clients in the for-profit area in Massachusetts, but Health New England does not happen to have a national network. If you need to go to, a center of excellence in Ohio, for instance, you want to have that availability. So that was one of the considerations when trying to engage. We wanted to make sure we had a national player. So it doesn't mean, folks, that Cigna will be our forever player. I want to be clear, as this collaborative grows, we're very positive that organizations like United and Blue Cross and Aetna and among others would have a lot of interest, especially if they see an organization that's vibrant and growing. So our hope is that in the future, being able to market this to other health insurance companies, because at that point, then we have competition, which will also further help contain rates.
Okay, we have just a few more minutes in the scheduled time allotted. Does anybody else have any other questions for the chat or to raise your hand? No? Okay. Tyler, I want to thank you for contributing to today's conversation. Some terrific questions were asked, and we are going to collect all of that information and keep the conversation going. The slide deck that Tyler shared and the recording of today's presentation will be made available. And we will also be sending a questionnaire out for your feedback, which is going to offer you a more confidential opportunity to share more of your thoughts, concerns, etc. So thank you very much for your time, and I hope you have a beautiful weekend ahead.
When is the Mass Council presentation?
I believe it's the 25th.
Say again?
June.
June 25th.
I think it's June 25th.
Yeah, it's Kathy, it's on their website now.
Okay, I will email you, Tyler.
Okay, great. Look
And
forward to it.
the Tyler's presentation will has his email in it, but Tyler, you might just want to pop it in the chat right now as well, just so that folks
Sure.
have that.
Not a problem. Let me put it in the
Okay.
chat.
All right. Thanks, everybody. Oh, wait, Alex just put her hand up. So now Alex gets to ask our questions.
Okay.
I also put it in the chat, and that was
Oh,
about
okay.
admin fees. Would those also be covered in September when you have what those would be?
Another good question. The admin fees are already in. So whatever that rate ends
Okay.
up coming out to be, it will be in there. And like I
Great.
said, we're going to be going over the actual benefits, what it includes, what it will cover, what it will not cover. And again, I don't want to oversell or overpromise. If there are certain things that are not going to be able to be covered because of either pricing concerns or what have you, we will address that at that time because we do not want you to have any kind of like a bait and switch situation where you're feeling that you were sold a bill of goods. We want to be completely upfront about what it will entail, what it will cover, and how it will be administered.
Thanks.
Okay. Any last questions? Last call. All right. Thanks, everybody. I really appreciate your participation. Excellent questions. And Tyler just popped his email in the chat. So more soon from us. Thanks again and have a wonderful weekend.
Take care, folks. Thank you.
Thank you all.